Hello, and welcome to this Bolder Healthier Community Champions webinar on behavior change. My name is Luceli, and I work for the behavioral science team within the public health division at Birmingham City Council. This webinar will be about a brief introduction to behavior change, which hopefully will help you and support your role as champions to help your community lead happier and healthier lives. First, I want to start with asking you to think about what behavior change means to you. Just take a couple of seconds and think about it. You can pause the video for a couple of minutes and then we'll continue with the webinar. Now, you probably have many things crossing your mind about what behavior change is. And behavior change is doing something which causes you to behave differently. Behavior change is problem solving because it helps us figure out why we do certain things. It's also broad because it can be applied to different situations, and it's valuable because we should always think about it when we're trying to improve things. What behavior change is not, on the other hand, it's a silver bullet. It's not the answer to every problem. Behavior change is not standard. What works for one situation might not work for another. Also, behavior change is not judgmental. It's not meant for us to be harmful or criticized. And finally, it's not exclusive. And we want to highlight this because anyone can change their behaviors. Anyone can help others change behaviors and not just experts. Now, why is behavior change important? We want you to know that we need to support individuals to live a healthier and happier life, and we can do this by supporting them with healthy behaviors. For example, healthy eating is a healthy behavior. We should eat 5 portions of a variety of fruit and veg each day. Also, not smoking can help us live up to 10 years longer compared to smokers. And being physically active is also a healthy behavior, and we can do that by exercising for 150 minutes of moderate intensity activity a week, or even just 25 minutes of vigorous intensity activity a week. Finally, limiting alcohol intake with a maximum of 14 units of alcohol a week across 3 days at least is also a healthy behavior. By engaging in these behaviors, then we could have a lower risk of heart disease, stroke, cancer, unhealthy weight gain, and many others diseases that are linked to unhealthy behaviors. The national picture, we can talk about the national picture because, as you can see, smoking tobacco has the highest UK annual mortality from non-modifiable behaviors. This is followed by poor diet, physical inactivity, and harmful alcohol consumption. So it's clear that unhealthy behaviors like these ones have lasting and negative consequences. Locally, the local picture in Birmingham shows us that it's very important to promote healthy behaviors because 2 in 7 year 6 children are classified as obese, and you have the definition of obesity in children on your screen. Also, 2 in 3 adults are overweight, although we want to make it very clear that overweight is not necessarily linked or is not necessarily due to unhealthy eating. You can also see that 1 in 10 hospital admissions is due to alcohol-related harm, and out of 1,000 people under 75 years old, 1 of them will die due to a cardiovascular disease, for example, heart attack or stroke. Now that we had this introduction, I'm going to talk a little bit more about the context of behavior change. So some of you might have heard about the combi model, some of you might not, but the combi model is one of many behavior change models which proposes that there are 3 components to any behavior, which are capability, motivation, and opportunity. And as you can see, That's where the COMBI acronym comes from, of C of capability, M of motivation, and O for opportunity. So all of these components, in order to perform a particular behavior, the person must feel able to do the behavior, and that's what we mean by capability. Also, the person must want to do the behavior, and that's motivation. And finally, the person must have the chance to do the behavior, and that's what we call opportunity. All of these components interact with each other, and as they interact, we must target at least one or more of these components to change and maintain behaviors. Now, we're going to have a closer look at what these components are. For example, first we have capability. Capability, as we said before, is the person must feel they are able to do something. And we have two types of capability. We have psychological capability and physical capability. Psychological capability means knowing what to do and having the psychological skills to do it. For example, you want to eat healthy, or a person in your community wants to eat healthy, but that person doesn't know any healthy meal recipe. And that means that that person is lacking psychological capability. Also, maybe that person is not confident on their cooking skills. On the other hand, we have physical capability, which means being physically able to do something. For example, the person wants to exercise, but usually they're out of breath when they're jogging. So maybe they feel that they don't have the physical capability to perform that behavior. Or maybe the person enjoys cooking, but she struggles or he struggles with lifting heavy pots when cooking, and that's why they probably don't have the physical capability to do that. When we talk about opportunity, it's that the person must have the chance or the right set of circumstances to do the behavior. Opportunity can also be physical or it can be social. Physical opportunity is about the environment and about cost and time. For example, having a gym nearby, or having a park, or the clothes to go to the gym, or just simply having the time to do a behavior. Social opportunity, on the other hand, is about whether it's culturally or socially okay to do a behavior. For example, maybe a person wants to exercise or wants to go to the gym, but they don't have anyone to accompany them, or maybe they don't feel safe alone, or maybe they don't feel comfortable socially, or maybe they feel discriminated in certain environments or settings. Then, the M for the combi model means motivation. Motivation means that the person must want to do the behavior. Motivation has also two types. We have reflective motivation, or the long term, and automatic motivation, or the now. Reflective motivation is about thinking about what has happened and wanting to make a change. For example, thinking about long-term benefits of physical activity, or thinking about a time where you were unable to play football with your children, and then reflecting on that and believing that if you start running now, then maybe you will probably be able to play football with your children in the future. On the other hand, we have automatic motivation, which is about the now. Automatic motivation is desires, impulses, and inhibition. And the person must think that healthy behaviors are more desirable than unhealthy behaviors. For example, if we have the example of before playing football and running, maybe a person starts thinking now that if running must be so much better than not running. Now that we talked about the combi model and how it works, and how it's a model that we can use to promote behavior change, then we can talk a little bit about examples of where people have used behavior change techniques to promote healthy behaviors. For example, we have Change for Life, which is a public health England campaign, the previous Public Health England, for families to make simple changes to diet. We also have Active Herds, which is the Herefordshire campaign to increase physical activity. We have Active Together, which is a campaign to get people to walk briskly for at least 10 minutes daily. And we have WV Gets Active, which is a more local campaign at Wolverhampton, which seek to increase physical activity. Taking one of those examples, which is Active Hairs, we're gonna talk a little bit more about it so we can have a more practical view or how the combi model works. As I said before, this was a campaign to increase physical activity. They used the combi model of capability, opportunity, and motivation to find out why people were not being active or find out how to increase physical activity. So on the psychological capability component, they found that some people were unaware of how much exercise they needed, or they had a lack of headspace, or they forgot to exercise on a given day. And on the physical capability component, they found that people sometimes have low stamina or energy. When we talked about motivation, automatic motivation, they found that sometimes people needed someone to support them or someone to answer to, or maybe people didn't have anyone to go with. In terms of reflective motivation, people maybe didn't know the long-term benefits of physical activity or just simply didn't see the point of being active. On the social opportunity component, they found that people were not comfortable in gym clothes or had a lack of confidence in general to go exercise or were very, very anxious about exercising. Finally, on the physical opportunity component, they found that people did not have enough money for the gym or they have a non-supporting physical environment. Now, to move on, and now after we have this practical example, we can talk about the impact you could make in your community with brief behavior change interventions. So now that you have a basic understanding of behavior change and the combi model, think about how you, as a Champion Plus, can encourage behavior change. You can pause this video for a few minutes and to think about it. Now, one of the ways to do it is by leading by example, providing information, and offering support and encouragement. Champion Plus can help people they are in contact with to develop healthy behaviors and make positive changes in their lives. Now, we're gonna look at two scenarios to give you a practical idea of how you can help others and support your community. The first case study is about Steven. Steven is a male, he's 35 years old, has a good but stressful job and a family with 2 children. But Steven drinks a lot and is starting to be more and more unwell. Now his partner isn't happy with his drinking habits and he wants to drink less alcohol, but he doesn't seem to make any effort. You probably know a Steven in your community, and now we're gonna see how can we genuinely help him. To do that, we're going to use the combi model and to try to understand Stevens. So what kind of questions can you ask Steven to understand him, to have a conversation, and to help him make a change? Perhaps some of these questions could be about capability. For example, what do you understand about the importance of drinking less alcohol? Or are you able to have drink-free days? Or if not, why? Also, we can ask Steven, like, what other ways to relax does he know? Or in what ways Steven's family and friends can support and help him? And maybe we can ask if Steven knows of any alternatives to alcoholic drinks, or if he has friends who do not drink. On the other hand, and within the motivation component, we can ask Steven how beneficial would drinking less alcohol be to him, or if he thinks that his friends drink the same as him, and why yes and why no. So I want you to try to have these questions in mind when you're having conversations with people like Steven in your environment and in your community. From those questions, and once you've spoken to Steven or people like him, then you will have a better understanding of their behavior. And maybe you'll probably find that he doesn't have the capability, opportunity, or motivation to make the change. So, for example, maybe Steven, in the psychological capability component, find it very hard to say no to his friends and his colleagues. In the physical capability component, maybe Steven doesn't remember an evening when he hasn't drank. When we talk about automatic motivation, probably he enjoys having a good time, he enjoys being relaxed, he loves the taste of beer. On the reflective motivation component, he this could be that he worries about his health, he worries about the impact on his relationships and on his relationship, and worries about the impact on his work, and that's why he wants to make a change. On the physical opportunity, probably Steven maybe has limited or no availability of non-alcoholic alternative drinks in the places he usually goes. Or in the social opportunity one, probably Steven does not have any friends who doesn't drink, who don't drink. So now we're going to talk about a second case study before we move on to talk about the things you can do to help Steven and to talk on to help our second case study, which is Rosemary. Rosemary is a female. She's 64 years old, and she recently lost her husband of 4 years. Right now, she lives alone. She feels the emotional and physical effects of her loss and has started eating more junk food and sweets. She also became more and more physically inactive and has developed breathing problems when going up the stairs. Now, let's think about, same as with Steven, how can we generally help Rosemary? In this case, we are also going to use the combi model to try to understand her. And let's think about what kind of questions can we ask to have a conversation and help her make a change. Perhaps we can ask about her capability, and we could ask Rosemary, what could you do, or what could she do to exercise, or what healthy meals does she know how to cook? Regarding opportunity, we can ask, what time do you have to cook or exercise? What is your understanding of the benefits of healthy eating? And maybe in what ways would you, your family, and your friends support you in this journey? Also, we can ask about motivation, and we can ask Rosemary if she knows how beneficial would a better diet be for her, or if she knows how to exercise and how exercising can help her relax. Once we do that, and once we've spoken to Rosemary and people like Rosemary, then we'll have a better understanding of her behavior. So maybe we'll find that regarding her poor diet and wanting to have better eating habits, maybe Rosemary doesn't know any recipes, so maybe she doesn't have the psychological capability to do the behavior. Regarding physical capability, probably her husband used to cook for her, so now she cooks very little in the past few years, and now she doesn't know how to cook. Regarding automatic motivation, Rosemary might feel sad and tired and now prefers to relax, and she feels that junk food tastes better. Regarding reflective motivation, she probably is unaware of long-term benefits of eating healthy. When we go to physical opportunity, Rosemary might think that it's easier to make junk food, it's easier to buy junk food. And regarding social opportunity, she might feel that it's easy to get junk food alone in her house. When we go to the second behavior, which is physical inactivity and how to increase that, how to be physically active, maybe we'll find that Rosemary doesn't know easy ways to exercise and is scared of having lack of breath, which is part of the psychological capability component. Maybe in the physical capability, Rosemary has breathing problems when she's physically active, and that's why she doesn't exercise. When we talk about physical opportunity, probably she does not want to make time to exercise. And in the social part, maybe she doesn't want to exercise alone and is worried to be seen out of breath. When we talk about automatic motivation, Rosemary feels sad and tired and she prefers to relax. And the reflective motivation, she's probably unaware of the long-term benefits of exercising. Now, now that you know how to have a conversation then about behavior change, we can talk about the things we can do to help others change behaviors. That could be through education. We can educate and provide information, knowledge, and skills to help change behaviors. We can explain that excessive alcohol consumption, for example, causes health issues such as heart disease. Or we can teach simple exercises. We can teach how to make simple and affordable healthy meals. We can also provide self-monitor suggestions. We can suggest that the person monitor and record their behaviors. We can ask them to keep a food journal to track daily food intake, and we can help them become more aware of their eating habits. Also, we can offer goal setting. We can set or agree easy and small goals with these people toward the targeted behavior. We can help them set weekly goals, or for example, increasing the number of fruit and vegetables per day until 5 pieces as specified in public health guidelines. Or we can prompt them by putting reminders to prompt a behavior, which could be with a sticker or with a sticky note on a fruit bowl on the kitchen counter, for example, as a visual reminder to eat more fruit. We can also put stickers on the bathroom, and this will remind people to brush their teeth at night, for example. And finally, another type of thing you can do to help people change behavior is suggest alternatives. By just suggesting healthy behaviors, such as asking or suggesting the person to walk or jog or exercise rather than watching television. Now, I want to give you some resources that you can use to help the community you are a champion and to signpost people to these resources. First, I want you to remember that when you're having conversations with others and when you're supporting others with behavior change, you need to listen, you need to support, help, respect, work together, and show compassion. You shouldn't confront people, you shouldn't judge, and you should not generalize. Most importantly, we should offer a friendship, be a friend, be there for these people. So one of the first resources are related to behavior change. We have behavior change resources like online trainings. And this online training is about behavior change literacy for individuals and workforce leaders. This is offered by Health Education England to educate and improve behavior change literacy. In your case, workforce leaders. You can click the link that will be on the YouTube description box, or you can also scan the QR code on your screen to get more information. We also have YouTube videos, very short introductory videos about both behavior change and the combi model. And you can also find the links on the description box, or you can scan the QR codes to get access to them. So we have 3 videos about behavior change and 2 videos about the combi model if you want to know a little bit more about that. Then we also have some websites. The first one is from the British Psychological Society. It's a very useful website with resources because psychology can give us insights into understanding people's behaviors. You can also find the links on the YouTube description box, or you can scan the QR code. And we also have a website with resources from the Behavioral Science and Public Health Network. It's very useful for professionals that are interested in developing and understanding health behaviors, well-being from a psychological perspective. And you can find the links on the description box, or you can scan the QR code. We also have this website or this tool, which is called the BCT taxonomy, which is behavior change taxonomy. a resource for intervention designers, for researchers, and for practitioners who want to work on behavior change interventions. It's also an app that you can find on the App Store and the Play Store. And you can go to the link on the description box, or you can scan the QR code. In terms of healthy behaviors, we also have some resources. One of them is a website called Better Health that you probably know. It includes information, tools, and apps that will make people make healthier choices, and they're related to losing weight, to quitting smoking, getting active, and drinking less. You can scan the QR code or find the link on the YouTube box. We also have these very useful apps that are provided by the NHS, and they use behavior change models to track and create healthy habits. You will need a smartphone to download them and to have access. You can find them both in the Play Store and the App Store. And you can click on the links that you will find on the YouTube box, or you can scan the QR codes for each one of them. And we have, for example, for weight loss, Active 10, Culture 5K, to drink less, drink free days, food scanner, and quit smoking app. More locally, we also have weight management support for Birmingham residents. These are services provided on behalf of Birmingham City Council. And to use them, you must be a Birmingham City Council resident and be at least 18 years old. And the good thing about this is that the person can be referred by healthcare professionals like you, or like a GP and every other healthcare professionals, or they might refer themselves. So this one is provided by Busybodies, which is commissioned by the Birmingham City Council, and they provide weight management resources for people with learning disabilities, for people with visual impairments, and for people with physical impairments. Then we have other support services for Birmingham residents, which are an app called Shape for Life, Shape for Life, which is designed to help people lose weight, lose 5% of body weight in 12 weeks, and it's available on the App Store, and you can also click on the links on the YouTube box. There's also a weight management support program, but this is for older adults, for people over 15 years old. It's called Momenta Weight Management, and you can click on the links or you can scan the QR code. And finally, we have this app. It's called Quit with Bella. It's a free 24/7 on-demand stove smoking service that you is also free for Birmingham residents, and that you can find on the link on the YouTube box, or you can scan the QR code. And thank you so much for everything. I hope this has been very helpful to you. And if you want any more information or feedback, please contact us at Boulder Healthier Champions at birmingham.gov.uk.